Hello everyone and welcome to week 4 asynchronous class for the Community as Partners 4525. All right, first kind of check-in is how's it going? You've attended your community placement this week. How are you doing? I would love to hear all about it. Maybe you can connect with me next week. I will have the opportunity to talk to you guys in class in week 5 and see how everything is going. Okay, hopefully you guys are enjoying and learning lots. Today we're going to cover a couple of different objectives. So we're going to discuss the concept of risk and self-management from critical framework. We're going to critique self-management strategies such as social marketing. We talked about these a little bit before as well, but we'll look to add this a little further. Apply the principles of critical theory to community nursing scenarios. And examine community mental health from critical perspective. There's a little bit of a application with understanding and a discussion forum that is set up for this week, and increase understanding of epidemiology related to community health. Okay, so let's look at that critical community health nursing. So we've got the determinants of health, we've got the upstream approaches, structural analysis, intersectional analysis, and social exclusion and mental health. I included this stream here again to remind you of what we talked about, the upstream approaches. All right, so determinants of health, these are a broad range of personal, social, economic, environmental factors that determine individual and population health. To determine determines one health self as an important place to begin when engaging in structural analysis of the community. So you have to understand what the determinants are before you even engage that structural analysis of community health. So here's a list of determinants of health. These are very, very important. Hint, hint, wink, wink, nudge, nudge. You need to know them, not only for the exam purposes, but know them for understanding the concepts of community health. So we have the income and social status. We've got employment and working conditions, education and literacy, childhood experiences, physical environment, social supports, and coping skills. We also have healthy habits or behaviors and access to health services. So what are those? Do people have them? Think of those individuals that are living in rural areas. Do they have access to the hospital? Do they have access to clinics? Do they have access to doctors? Okay, biological, genetic, factors, gender, culture, race, and racism. So let's pause here for a minute and think about this question for the structural approaches. How can the social determinants of health assist nurses in structural assessment of health and illness? Why do we need to take those into account? Why do we need to know what they are? Think about that. Think about it for a minute. All right, social inclusion and mental health. We've got the different kind of levels that encompass the social exclusion and poor mental health. And we've got marginalization, psychiatrization, and structural oppression. Okay, so let's put that all together and reflect on this. So I need you to go to this website that I have indicated here. This is also posted under the discussion forum in week 4 to listen to the Julie's story. Okay, listen to the podcast and reflect on what she is saying, what she has experienced, what she's advocating, and answer the following questions in a large forum discussion. So what social determinants of health are relevant in the story? Okay, what are they? What is the relationship of the community mental health and social identity, such as gender, sexuality? What else is there that she's mentioning? Okay, what else did you learn from her story? Was this a surprise for you? Was this something that you already know maybe? Was this affirming to what your knowledge is about her story? Or was it total surprise? So I would love to hear from you. So please go to discussion forum in week 4, post the answers to these, and reply to at least one person, please. Critical thinking. So what is that? We keep telling you critical thinking across all sections, all courses, all clinical aspects. What is that critical thinking? So our awareness of own assumptions, values, and beliefs, and the impact of practice. You've got the attributes that are emotional, intellectual, that allow to the analysis and clarification of the issue, gathered and appropriate evidence, research, and theory. And questioning values, assumptions, and beliefs, and synthesize the application of information to the product, alternative options for actions. All right. So the self-evident would be natural universe, abstract critical thinking, and in mental health is direct to individualism's accounts for mental illness, as sometimes located within the person, such as victim blaming, which we discussed a few weeks ago as well. Economic burden of the disease, and control of individual conduct and population governance. Okay, so once again, think about that critical thinking, but from the lens of community health nurses, and what does that mean? Okay. So history of the present. So it begins with that current issue phenomena and looking historically at how this issue is not as self-evident as it may be present currently. Okay. So looking at the complex historical process, accidents, politics, power, and interests. So really looking at it critically. So I have this picture here, right? So reflect on this picture, look at it. And it says, I wouldn't wear a helmet. It makes me look stupid. What do you think of this picture? I would love to hear from you. But what do you see? How do you see it? Okay. Or maybe you've done your readings already. How do you see it now? What does that mean to you? Okay. So risk and self-management. So risk is the need to manage potential for negative health outcomes based on calculation probabilities. So overlooks individual differences and social divisions, their risk and a cost, and really articulates the risk and management together, achieving interests that are not necessarily in line with patient centeredness. So, what are your thoughts? What are your patient's thoughts? And maybe sometimes they don't align to that patient centeredness. So let's look at these pictures here. This one is related to MAD, which is Mothers Against Drunk Drivers. What do you see in these pictures? What does the media say with regards to drinking and driving? Okay, you can see here, don't be an idiot, don't get smashed, right? And each day, 14,000 injuries and 15 deaths occurred to teens drivers. 40% are alcohol related, right? How about this one? Choose less, weight less, okay? So you've got portion sizes, you've got the calories indicated. Sorry, it's a little blurry here, but it's from choosehealth.com, and you've got smaller portions here, right? So indicating the calories intake, and each day if you eat like this, your calories are almost double. What does this picture say? Being critical. What does that mean? So attend to structural analysis of health and illness, that social determinants of health, the root cause of analysis. So you really have to, provide that assessment, provide that research, and really understanding the root cause, right? Ask questions, ask the why questions, try to understand the policies and practices that are embedded, promote that self-management, a diverse, socially situated process to promote that, and promote again the negotiation of the risk as a unique for each person and each community. So, talking about comparison of a rural area versus urban area. what are the risks that are unique to each individual community. It can be, a policy that could be implicated for both, and what is that look like, right? How do you apply to a rural area versus urban, and what access do you have, such as transportation, for example, or public transportation, such as buses, or even taxis or Uber, right? Okay, a couple more slides about epidemiology that we're going to focus on right now. So what is epidemiology? Let's look at the history. So it is a study of determinants of biomedical health related to state of the population and the application of the study to control the health problems. Right? So it's understanding the health study of the actual problem. So let's look back at COVID and what has happened. Let's look back to March or even April of 2020. What did that look like? We heard the news saying we have 2 cases here, we have 3 cases here, and that our cases quadruple, and they were in thousands, and they were spread over the world. So collecting all that data was in effect, right? Epidemiology wise, what did that look like? So first, the history of it was through the cholera epidemic in mid-1850, when John Snow noticed the relationship between cholera deaths and drinking water source. So that's why this picture here. He has identified that polluted waters or unclean water was not safe to drink, and he related to the deaths. And also we can relate it back to Florence Nightingale. She used the influence and record keeping to implement that sanitation practices significant to decrease the deaths of the soldiers, right? And she implemented the clean water, lighting, so on and so forth, of the environment that would decrease the deaths. So she looked at that. So epidemiological triangle, it looks like this. So we have the host at the top, we've got an agent, and we've got the environment, right? Let's look at this video. Hopefully I can play it on here. It's just a quick short video. It's mainly to read through versus listening. So let's see if this can play this way. All right, so what surprised you about that miniature Earth? What kind of messages came through? It was from 2010, so maybe a little bit of the numbers or the skews changed a little bit, but it's pretty accurate still. My thing that surprised me is the last picture where it said food in the fridge, bed you sleep in, you have a house, and that's more than 75% of the population. That I am proud to have, or that when you do have those things, you are richer than 75% of the entire world population. That to me is absolutely shocking, right? So epidemiology variables. So you've got modes of disease transmission, direct or indirect. Some of the example which I gave you already is COVID, or maybe some other kind of viruses before, such as flu, such as H1N1, such as even the kind of viruses that are going through the hospital, such as MRSA, VRE, things like that, okay? It's a natural progression history of the disease. So now that we are, coming out of COVID in the pandemic, there's still cases, but there's less of it, or the mutation of that disease, right? So epidemiological variance really looks at all of those aspects of it, and it looks at the population health. So we've got the natural history of any disease of men. Okay, so there are, the highlights worked out a little bit odd here. So really just looking at the beginning. So you've got the agent, host, environment factors, which I discussed. Then it looks at the health promotion aspect. So health education, good standards, nutrition, attention to personality development, provide adequate housing, recreation, marriage counseling and sex education, genetics, and selective examinations. Okay, then you've got the specific protection, and just look at a few here. So attention to personal hygiene, use of environmental sanitation, protection from accidents. Next one, you've got early diagnoses and promote treatment. So screening. Do you remember all that screening that we did at COVID? We still may be doing some screening when you're going into certain organizations such as maybe like long-term care. So that's early diagnoses, right? And promote treatment and protection of that population. So the long-term care would be protection of the residents at that home. Disability limitations, so provide provision of the facilitation of the limited disabilities and prevent deaths, adequate treatment for individuals, and rehabilitation. So provide hospital, community rehabilitation, education, education to public and industry to utilize rehab as full employment as possible, and select placements and shelters as well, and therapy in a hospital as well. So Caucasian and association, you've got the three here. So as association, there is a reasonable evidence that is connecting between existent stressors and health challenges. So you have also Caucasian, which is an association that has been confirmed beyond doubt and could not happen by any chance. And Web Caucasian, this is where it is important to note, hint, hint, winch, witch, nudge, nudge. And this is where the CHNs visualize the relationship that influences a given health challenge. So it can help us discover the source of the health issues, can provide us with information that may confirm or deny what is happening in the communities, and allow us to account for the merit of factors that contribute to the health outcomes and behaviors for particular incidences that are happening. Okay, so let's look at that in a little bit more detail. So here's that Web Caucasian for the tobacco use. Look how many factors affect that complex, such as the tobacco use. Okay, and you can do this with really anything. So you can see media images, poor enforcement, easy access, tobacco purchases, usage, peer pressure, view of the use of adult behaviors, public acceptance, poor understanding of the health effects, right? Adult as a role model, testing family values, and decisions to use the tobacco. So all of those intertwine as a web Caucasian, and the reason why, this particular teenager might be smoking, right? So it's not just one factor. So measurements of epidemiological data. So this helps us to determine the exact disease process or health challenges. It really understands the final effect of the population through the data collection and analysis. So collecting that data, once again, let's go back to that COVID, collecting the data, analyzing it, seeing if there was any trends that was happening through the data. What does the data show us? How do we, minimize and optimize the population health? And, certain areas, like I'm thinking of, remember how COVID was predominant in certain countries? What were they doing? What were they exposed to? Or some other countries were not. So how come they were not affected? What were they doing differently? And then learning from those experiences. Okay. Here's a couple other examples of commonly used rates in epidemiology. This is right from your textbook, table 9.1. So you can look at formula, for example. So total deaths from any causes a given year in population. So that's the mortality rates. Specific mortality rates would be the total deaths from specific causes is given year to a population, so such as a subgroup, for example. Infant death rates would be the total deaths of infants in a given year in a population, and total number of live births in the same population as well. Prevalence rate, these are the number of people with given disease in the population at one point in time, at that time, and a total in given population at the same point in time. Incident rate, so these are related to that new cases of given disease in a given time, maybe looked at that specific 1 year, an average total population at the same time. And relative risk, this is incidence related to the disease, an exposed population, incident of disease, and unexpected population. So how to access communities? How do you access those, right? We talked about community assessment, windshield survey. We talked about identifying threats and needs. Okay, and how do you reach out to those communities? So we've got non-contact method, minimal contact method, interactive contact method, and multi-method contact. So this is really for epidemiology, can be objective data and numbers. So getting the numbers from here, right? You want to focus on, what are the numbers? How am I getting that information through? We'll go into detail in just a few slides. We'll look at each one of them. But, when you are doing your community assessment for your big paper, a lot of you will be asking me, okay, how big of an area should I be doing? Or how small of an area I should be doing. It really is up to you how you're going to do that community assessment, right? So it could be something small, but your numbers that you are getting from that population or that geographical area are large, okay? So it's a good cross-section of for the entire population. Or you might go a little bit bigger, therefore you'll get more numbers. Maybe you even get a little bit of a different numbers. And I can relate this back to, let's say, crime rate. So if you look at a small section of geographical area, maybe like, okay, let's look at mine. So I live in Stouffville, right? So I can look at Stouffville as a cross-section of crime rates and look at the police reports. This is all public. I can go on York Region Police and look at where the crime rates are. But let's say, you know, maybe they only have reported, let's say 10 in the last month. 10 that last month. But then I would like to expand even that assessment a little bit better and a little bit further, and I can look at York Region because Stouffville is in York Region. Now, when I look at York Region as the assessment of crime that is reported and available to the public through the website, now we have, you know, maybe 80 or 90 different crimes that happen across these. And then I can also see the actual map where those crimes are happening and what kind of crimes are happening as well. So this is where an example of a community assessment is. So the non-contact method. So this is looking at that demographic. So for example, looking at the population, unemployment rates, deaths, crimes, divorce. We can look at the impact of race and culture and mortalities. Okay, documents, reviews, newspapers, newsletters, local health departments. So that's non-contact, as in you will go out to the source, and even the example that I gave you about going to the York Region Police Department to looking at crime rates. Minimal contact observation method. This helps the CHN to gain the initial impression of the community. So we talked about that windshield survey, that walkthrough, sitting in the neighborhood coffee shop. Yes, you learn so much just sitting at a coffee shop. Even, you know, looking at the individuals that are coming through, you know, who is coming to the coffee shop, okay, and collecting that data. And then attending community forums. So this could be through the town, attending town halls, any public forums that are available through the local towns as well, as an example. Next, we have interactive contact method. So this is the key informants interviews, such as the quote, kitchen table talks. Okay, the door-to-door surveys, small group assessment, focus groups, collecting community stories, right? And through community participation such as a photo voice. So this is an alternative way of actually getting engaged with community members and getting involved in that assessment. And multi-contact. So this is really use of the hard data, health status needs, community participation to identify the health issues and resources. And this is all sometimes called triangulation. Okay, so a triangulation of all the multiple different ways of collecting that. Okay. 4 types of community assessment: windshield survey, walking survey, focus groups, survey findings, and key informants interviews. And I talked about that last week as well. So what are the roles for CHNs within the epidemiology? So it is really to prevent the disease. So what roles do you have? How do you prevent the disease as a community health nurse? How about surveillance, right, of the disease, and monitoring and research? Access to resources. The government gives specific guidelines to follow for each specific municipality, for example, or public health, right? So how can we find that information about the population? So if we were researching a particular community, there could be some epidemiology data that would help to understand what is immediate needs, right? Through that, you can look at the data and what is it showing. The link to the assessment that you have done and a link to what is happening within the community. Okay, here are some key questions that I encourage you to continue asking when you're doing community assessment, asking when you see different things, asking when you are learning these concepts. So, you know, the first one is what? So did you do what we said you would do? Okay, so key questions for individuals within the community. Why? So what did we learn about what worked and what didn't work from that incident? All right, from that data that you collected. So what differences did it make that we did this work? So what? We collected all this data. So what now? Like, what are we going to do with that? Did it make a difference? Now what? Right? So what could we do differently? Did we collect enough data, or we didn't collect enough data? Do we need to further investigate? Or what is the data telling you? So how can we make a difference with the data that we have? And then what? So how do we plan to use evaluation findings to continue the learning? How are we going to continue learning about the communities through this? Okay. And here's a question for you, true or false. So a community assessment would include how many fast food locations in a community may have. Is that true or false? What do you think? That is true. It is so true. What fast foods tell us about the locations of the individuals? What fast foods tell us about the population? Food for thought. Haha. That is all. Thank you so much for listening to this. Make sure you do your readings. Make sure you listen to that podcast, and make sure you provide the discussion forum under week 4. We will see you next week. I would love to hear about your experiences with your clinical placements, and as well as we'll do some practice questions for your midterm that is coming up in week 6. Thank you so much. Take care. Bye-bye.